Best way to fix joint pain? Painkillers? Nope. Ice? Nope. Physical therapy? Nope. Here's what actually works. I'm going to show you something about your knee that most doctors never explain, and it could save you from years of bone-on-bone agony and possibly even save your life. Look closely at this joint image. See these tiny red dots floating inside your joint? Those are inflammatory proteins called cytokines. Your joints are the perfect trap for these inflammatory proteins because they're isolated. Unlike your liver or kidneys, who have massive blood flow constantly, your joints are sealed capsules with limited circulation. So once the proteins get in, they have a very hard time getting out. But in normal, healthy joints, they do get out. That's where your synovial fluid comes in. See, between every bone in your body, there's a golden liquid called synovial fluid. It's literally the difference between a joint that glides and a joint that grinds. This fluid has one job: to drain out inflammatory proteins and toxins. But here's the problem. As you age, this fluid dries out, and what little is left gets contaminated and sticky. Then these proteins don't get flushed. They pile up inside your joint like garbage in a blocked chute. Day after day, week after week, year after year. And these proteins don't just sit there causing pain. They attack. They eat away your cartilage. They thin the cushion between your bones. They trigger more inflammation, which floods your joints with even more proteins. It's a vicious cycle that compounds every single day. And that grinding sound you hear when you bend your knee, that clicking, that's not normal wear and tear. That's the sound of protein-damaged cartilage breaking down. Keep letting these proteins build up, and you're looking at chronic bone-on-bone agony, a wheelchair, or worse, complete loss of independence. Meanwhile, doctors keep prescribing pills and treatments that only relieve inflammation and never the protein buildup causing it, which means you'll need more and more appointments that never lead to lasting pain relief. But here's the part that may really terrify you. Those same proteins destroying your knee or your back, they don't stop there. Every time your heart beats, more of these inflammatory proteins travel in the blood to your arteries, organs, and even your brain, silently accelerating through your entire body. We call it inflammaging, and it's why people with knee pain have dramatically higher rates of heart attacks, strokes, diabetes, and dementia. Your knee pain isn't a knee problem. It's an early warning that your body is drowning in inflammatory proteins. It can't flush out anymore. Ignore it, and you're not just risking mobility, you're gambling with your longevity. So what can you do? Thanks to Dr. Kyle Stevenson, an orthopedic surgeon who worked with the Boston Celtics and Harvard Athletics, you can restore your synovial fluid and give it what it needs to capture and drain these toxins naturally. His simple 30-second bedtime routine works in just 7 days to clear the inflammatory protein buildup, stop the cartilage destruction, and move freely without pain again, while also protecting your heart, brain, and long-term health. Dr. Stevenson made a short video where he'll show you exactly how to use this technique that you can do right from home. So click below now to watch Dr. Stevenson's presentation. You won't have to put in your email or anything like that. It's just a quick video that shows you what to do in a few easy steps. Don't let another day go while toxic proteins eat away at your joints and continue circulating through your bloodstream, destroying your cartilage, threatening your lifestyle, and putting your entire health at risk. So click below now to discover Dr. Kyle's 30-second bedtime technique has already helped thousands of people eliminate pain proteins from their joints, move freely, and reclaim their freedom. No more avoiding activities. No more sitting on the sidelines.